Welcome to Meet Me for Coffee. I got an amazing guest. You might recognize him from the Joe Rogan show. He's epidemiologist, cardiologist, Dr. Peter McCullough. Thank you so much for joining us.
Thanks for having me.
And it's called Meet Me for Coffee. It's about coffee conversations that we should be having. How do you take your coffee? Do you drink coffee?
I take it with a little half and half in Splenda.
All right, fantastic. And well, you know what? Is coffee good for you, doctor? I think it is.
There are studies that showing that this coffee is good for you. It certainly doesn't cause harm. About 99% of doctors are completely addicted to coffee. So, boy, we hope we're not doing harm. People have enjoyed coffee for a very long time. I think it's probably one of the more enjoyable parts of my day is that first cup.
Absolutely. Well, same here, and same with the last cup. I probably had like 5 or 6 today. So, I want to thank you for joining us. We got lots to get through. The first question I want to ask you, I know you've mentioned in the past that you are fully vaccinated. I'm fully vaccinated as well. Knowing what you know now about these vaccines and COVID, would you recommend taking the vaccine? Is it safe?
Yeah, I'm going to clarify. I'm fully vaccinated with all the evidence-based, safe and effective vaccines, but I haven't taken the COVID-19 vaccine
Okay.
because I had COVID-19 in October of 2020. And the FDA and the vaccine manufacturers agreed that someone like me couldn't benefit from a COVID-19. That's the reason why someone like me, I would have been excluded from randomized trials. So no, I haven't taken the COVID-19 vaccines. Because of that, it's just simply a regulatory fact that that someone like myself, I couldn't even be in a randomized trial of getting a vaccine if I wanted to. And now we've learned that those who are COVID recovered, that if they take the vaccine, there's no opportunity for benefit. In fact, they're harmed by the vaccine. So no, I wouldn't take a COVID-19 vaccine because I don't want to be harmed. And no one in my situation who's had COVID-19 respiratory illness should take a vaccine.
Well, absolutely. And I've had COVID as well. And I've always been searching for that answer. Our government here in Canada is basically trying to coax people into getting both their shots. Now we're able to get the third booster, and nursing homes are most likely getting their fourth shot. In your opinion, is it safe to get 3 or 4 shots in your body a year?
We don't have adequate safety data to basically make that claim. The vaccines have not been particularly efficacious. Our CDC director in the United States came out in the middle of summer and said, the vaccines have failed to stop the spread of the virus between vaccinated person to vaccinated person. And then we have data by Singarajam published in the Lancet showing 39% of all spread is among fully vaccinated to fully vaccinated. And then data from Nordstrom and colleagues, as well as 22 other studies, show the vaccines basically run out of coverage after 6 months. They run out of coverage. And so the agencies have all agreed, well, the solution to that is to give a booster. And now we have data from November 4th by Young Zhu and colleagues published in JAMA showing that with the Delta variant in high Delta areas in the United States, the vaccine efficacy was only 20%. And we had 99% Delta for months. So no, a vaccine that only has 20% vaccine efficacy is not one worth giving a booster because it's not going to boost it more than 20%, at that level of coverage of 20%.
Is there any evidence, like how do they identify what variant is in circulation? Do they test every patient or they just assume?
The Departments of Community Health do genomic sequencing, so they know what people have based on regional samples. And then they use a modeling program called Nowcast. And it's pretty good. The CDC does this to anticipate where we are. And they adjust it. You can go online and figure out where we are. January 4th, Nowcast is predicting, of course, the data will come in arrears, but it's predicted, I believe it's true, 93% Omicron in the United States. And you know what? Good riddance Delta. Because Delta was a long and hard outbreak. Omicron is so much easier, so much milder, briefer syndrome.
Are the vaccinated people more at risk of infection from Omicron?
There are some data to support that. There were studies and reports from the UK, Denmark, South Africa, and the very first CDC report December 10th on Omicron said over 70% of everybody with Omicron was fully vaccinated. There's been a report from Germany, over 90% of people with Omicron are fully vaccinated. I'm not really seeing that way. Honestly, in my clinical practice, I see that Omicron's broken through natural immunity. So those who've had COVID-19, like myself, can get Omicron. In fact, that happened. It's a very brief and mild syndrome. The vaccinated clearly can get Omicron. And again, it's a brief and mild syndrome, maybe a little bit more severe than somebody who's naturally immune. And then the unvaccinated, COVID naive, certainly can get Omicron. It can be a more difficult illness there. But across the board, I think everybody can rest assured that Omicron, we're down to, in a paper by Abdullah and colleagues, we're down to 1% inpatient mortality in South Africa, 1%. And they don't give any early treatment. So if we actually have early treatment in a high-risk Omicron patient with severe symptoms, I fully expect now that COVID mortality is deeply below 1% for everybody. And so we can rest assured we're not going to end up in the hospital or worse.
That's fantastic news to hear. There's a lot of skepticism around how to treat yourself when you've got COVID. They say go get a test. Yeah, get a test. But when you're in the hospital, then they'll treat you. But what can you do when you're developing symptoms? Is there something you can keep around the house? I know ivermectin. I'm not sure if that's available here in Canada. There is HCQ as well, hydroxychloroquine, and but what are some things that I can keep around the house in case I start developing some of these symptoms?
Our approach has become much more sophisticated. And fortunately for Canadians, Canadians can have a shoebox of 6 things that they buy over the counter. 6 things. So here they are. No doctor needed as a home survival kit. The first and most important is povidone iodine or betadine. That's the brown iodine liquid that doctors use in the emergency room to sterilize wounds. It's available for external use. It's about $5 on Amazon or any online retailer. And what you do is you take half a teaspoon of the povidone iodine in a shot glass of water, 1.5 ounces of water, and then take a bulb syringe or a spray bottle and spray it up in the nose over the sink, because someone's going to drip out. Sniff it up in the back of the nose and spit it out. And do it twice in each nostril. The rest of it, just gargle with it and spit it out. In the setting of acute COVID-19, you can do that up to every 4 hours, and that's amazingly effective in reducing the intensity and duration of symptoms, rapidly clearing the PCR, and markedly dropping any risk of hospitalization death, proven in randomized trials. So povidone iodine is in the kit. Now, if one cannot tolerate iodine, has iodine allergies, use dilute hydrogen peroxide. Any form of hydrogen peroxide in a 1-to-3 dilution can also be used the same way. Okay, so that's in the kit, one or the other. Now, what else should be in the kit? Zinc, 50 milligrams of elemental zinc a day. More data showing it's preventive. Vitamin D3, 5,000 international units a day for prevention. Acute treatment now, we go 20,000 international units a day for 5 days. Okay. Vitamin C, 3,000 milligrams a day for acute treatment. Quercetin or quercetin, 500 milligrams a day, once a day for prevention, 500 milligrams a day, twice a day for treatment. And then number 6, the final thing in the survival kit is famotidine or Pepcid, which is an over-the-counter antacid antihistamine. But instead of 20 milligrams, which is the package label, take 80 milligrams a day acute treatment. So those 6 things ought to be in a Canadian survival kit so all Canadians can be prepared. We are still getting panic calls from patients saying, "Doctor, surprise, I have COVID." And it's like, we're 2 years into this. There should be no more surprise calls. After I finish here, I'm going to spend another 3 hours handling surprise calls. No one should be surprised anymore. I am shocked how people are not ready for COVID-19. Everybody needs to get in gear here because this early treatment takes the edge off symptoms, reduces the intensity and duration of symptoms, and by that mechanism leads to reductions in the risk of hospitalization and death.
Well, thank you for that answer. That's something that I would have liked to know a long time ago before I got COVID, and was actually diagnosed with it. And for the record, in your opinion, I know there is proof of this. Can someone be asymptomatic and spread this virus?
No, they can't. 2 good studies have disproven that, Cow and Madewell. And so despite prior modeling studies that guesstimated that was possible, it can't. And you know what? It's good news, because if COVID-19 could be spread by 2 asymptomatic people, it'd be the first disease in the history of mankind where that's the case. So no, just like any other communicable disease, one must be symptomatic to spread it.
That's fantastic news because you know why? Because up to about a few weeks ago here in Canada, we were getting tested if you're in the vicinity of anybody who was tested positive. So there, it's good to know that I had no reason to actually go and get this test done. The PCR test, with this, many people have said that it has created a pandemic out of nothing, pretty much, giving many false positives. And like, why do countries like Canada run tests through close to what 50 cycles to get the results? Why?
It's an administrative overreach that needs to stop immediately. Our CDC says no PCR should go above 28 cycles. All that was doing is generating false positives. The World Health Organization, CDC, and FDA all agree that the test should not be used on asymptomatic people. So we need to stop that. It's a regulatory overreach. No one should undergo an asymptomatic test. We shouldn't. All we're doing is generating false positives, making things uncomfortable, logistically difficult and expensive for no reason.
At the beginning of COVID here in Canada, around February 2020, uh, they tried to scare the living hell out of us, right? On mainstream TV, there was videos of China, people killing over and dying on the street. Here at the Walmart by my house, it was cleared out. All the non-perishable food was gone. People were taking boxes of canned food they probably won't never eat, water and supplies. Now, fast forward to 2022. Uh, there are no people dying on the street from COVID, like depicted in those videos. They showed us we all got scared. There are no lineups in the hospitals or the hospitals being overwhelmed. In fact, they ended up firing the nurses for not actually getting the vaccine. And that's why we have a shortage in Medicare. Um, what do you say about this mass psychosis they're trying to drive into people, um, making the fear factor and I don't know how to explain it, but you explain it pretty well. Making them think that something's going on that's really serious. I mean, is this a really serious pandemic, doctor?
It's serious for those who are very high risk, very old seniors, those with terrible medical problems. Sure, it's a serious illness for a tiny fraction of the population. That population needed all of our attention. But it wasn't something where we have to clean out the shelves of Walmart. I bet they left the povidone iodine and hydrogen peroxide on the shelves. I bet they actually left the most important things on the shelf. I bet the Pepsid was on the shelf. When we look backwards, it's interesting now, now that people actually know about povidone iodine. I don't blame anybody because the randomized trials really weren't done until January, February of this year. But someone contacted me today that on Amazon right now, it's 4 weeks to get a bottle of povidone iodine. So listen, the word is out. People have figured this out. They've been doing this in Bangladesh and Pakistan, all over the world for a long time now. Finally, America and Canada figured out the problem is in the nose. The virus is in the nose. You have to kill the virus in the nose. It's not a hand infection. Being obsessed with hand sanitizer is not working, or putting a mask on when the infection is in the nose doesn't stop the infection in the nose. You actually have to treat the infection in the nose. Some of these things are so common sense and so simple. It's embarrassing that we're getting back to this 2 years later.
Do masks work?
No, unfortunately, mask expert Stephen Petty, I did a chance to present with him. He shows a typical mask, 18% of the air goes right around the mask. The masks only filter out 3 microns. The virus is 1 micron. So no, if you're going to get a big blast of COVID-19, masks don't work. So there's no role for public masking whatsoever. I think people who have close contact, doctors, nurses, dentists, dental hygienists, maybe barbers and salon operators, it's fine to wear a mask, mainly to just, from a courtesy perspective, try to block a big sneeze. But otherwise, we shouldn't rely on masks to stop the pandemic. It's obvious they haven't.
Because if you're sick anyway, you'll show symptoms, and if you're not going to be contagious, right? So, at what point do you become contagious with your symptoms? Once you show symptoms, you're contagious?
Yeah, that's the tricky part. And Joe Rogan asked me about that. And he goes, well, the problem is, he goes, I was out playing pool and people were drinking beer. And one guy thought he was getting sick and he still continued to play pool with us. And we all got COVID, something like that. I said, well, that's the problem. When people start to get sick, they have to withdraw from congregate settings. So it has to do with perceptiveness of symptoms. And I think that's the key thing. I think if we had flex travel policies, flexible work and school policies, if someone was getting sick or sick, to simply give them a break so they don't have to show up into the workplace, that would go a much farther way as a public health intervention than mandatory public masking.
What is the narrative with the vaccine? Like, why they keep pushing the vaccine if there's another there's many other cures, right, combinations you can use to get yourself better from COVID-19. I know it's for to limit the hospitalization and help the hospitals, but was there not a trial that found that there's spike proteins that can last in your body for close to a year after you take a vaccine?
Yeah, the public health response has really been to focus on the vaccines, which are not treatments. So most countries have monoclonal antibodies, and they were provided through the same mechanism. In the United States, our monoclonal antibodies were approved before the vaccines, but there has been no focus on treatment. In fact, monoclonal antibodies have been largely ignored by our federal stakeholders, and they've basically had a monocular focus on vaccination, which doesn't apply to sick people. So I think it has to do, the biggest question is, why aren't we focusing on sick people? Why aren't we focusing on phone call systems, identification, helping them, the right survival kit that we went over, using monoclonal antibodies, using other oral drugs in a sequence combination? Why is there almost no mention of the problem? The problem is some people can get really sick with COVID-19. So now you enter in the vaccines. The vaccines we've had a year of them. In Canada, in the United States, they're all genetic vaccines. They install the genetic code in a mosaic of cells in the body, including really important cells like cells in the brain, the heart, bone marrow, and elsewhere. I've never had vaccines go to these organs like this. And then they install the code for production of the spike protein. The spike protein is the dangerous part of the virus, the spine and the ball of the virus. Spike protein damages tissues. It causes blood vessel injury, causes blood clotting. And now we've learned it takes forever to get a spike protein out of the body. Work by Banzel and Bruce Patterson have shown months and months, probably over a year after a vaccination, it would take to actually clear this toxic protein out of the body. And you can imagine shot 1, that's a year. Shot 2, another year. Booster in 6 months, another year. There's great concern. Scientists are concerned that actually spike protein accumulation without letting the body clear it out is going to cause disease in critical organs like the brain, the heart, the bone marrow, and the immunologic system.
That's not something I like to hear right now. Will this we keep doing the vaccine? Say we keep doing the vaccine every 3 months, 6 months. Will it make us be dependent on this vaccine? Was there a reliance on it?
No, I think it simply doesn't work. A paper by Zhang Yu showed in November 4th in JAMA that the vaccine efficacy against Delta, which is 99% of what we had, was only 20%. So the vaccines may have had some benefit in the extinct variants, but the current Delta wave that's now being replaced by Omicron, we don't have any supportive data that the vaccines are going to do anything at all.
Oh wow. Why can't medical professionals have a great conversation about this and share their ideas and tell each other what works? I find that it's just a one-way street, especially here in Canada. Do you believe lockdowns work?
No, there's no data to support lockdowns, working. I had a chance to have dinner with Scott Atlas from Stanford Hoover Institute at a meeting in Columbus, Ohio, about a month ago, and Scott had all the data on lockdowns, and I think he's got it. He's correct. Lockdowns had no impact whatsoever because we locked down the wrong people. Locking down well people doesn't do anything for the virus. All we needed to do is basically isolate the people who are sick. So a lot of this is just common sense. If you lock down a bunch of people who don't have the virus, it can't possibly have an effect. But if we just lock down or isolate those who are sick, that's how we reduce spread.
Are you in contact with anybody up here in Canada, any medical professionals that you've talked to?
Yeah, so we have great good collaborations in Canada, both on the media side, some other great podcasters, Sean Newman, Mike Martinez, but we're in communication with Ira Bernstein in Toronto, Roger Hodkinson, a whole variety of experts across Canada that are leading the way. You have a leading virologist in Guelph, Byron Bridle, and some heroic doctors, Francis Christian. There's a lot of Canadian heroes there. And the general, profile of a COVID doctor hero is a doctor who's courageous enough to treat someone with COVID to prevent hospitalization and death, and a doctor who's fair enough to explain that the vaccines have very serious risks and they have to be weighed in balance with what the potential benefits are, if any.
Byram is the next person on my list. I will tell you that. He's just down the road from me, and hopefully that'll happen. I kudos to him for coming out and telling us what exactly he found in this vaccine. Like I said, it's just a one-way street here. So like it's like having a bully where one person says something, and that's how it goes. Um, why is that? Why is it just a persistence on pushing one thing and not listening to anybody else who, obviously your expertise or Dr. Malone's or Byron Brittle's expertise, like or Bridle, sorry, his expertise. How come there's all this false information? People try and debunk what you say, and they don't actually listen to what you say. There's so much false news and people going against you, what you've proven that it is true. So how come we're in this mess?
Well, there is a free interchange of data convened by very good organizations in the United States. We have the Association of American Physicians and Surgeons. They've had their annual meeting. We have had detailed sessions on COVID-19, both treatment and vaccine safety and efficacy. We've had tons of online activities. The same is true for patient advocacy on vaccine safety and efficacy and early outpatient treatment. The Truth for Health Foundation, multiple forums. The Frontline Critical Care Consortium, completely separate approach, separate protocols, having large public forums. So people like Dr. Bridle, myself, Roger Hodgkinson, Ira Bernstein, we are interchanging ideas all the time. The question is, where's everybody else? Where's the University of Toronto? Where's McMaster? What has McGill done in terms of advancing the care for COVID-19? What's their outpatient treatment protocol? I'd love to know. How does McMaster handle vaccine injuries? What's their approach? How do they characterize them? We haven't heard from any of the big time Canadian academic medical centers. To my knowledge, there's not a single Canadian original protocol on how to treat COVID-19 as an outpatient. In fact, I'm not sure these centers even tried to treat a patient as an outpatient. I mean, since when are these brilliant Canadian organizations out of any intellectual ideas on how to approach a novel syndrome? How about University of British Columbia? You don't have that much COVID up there. You could actually organize patients into protocols. Where in Canada is the Canadian Center of Excellence for Treatment of COVID-19? What hospital in Canada has pride in treating COVID-19 based on their innovation and their excellence of care? Which center in Canada is actually recruiting patients with COVID because they're so good?
I don't know. I can't answer that.
Doesn't that strike you as odd? Because these centers compete fiercely for cardiovascular disease patients, for cancer patients. Why suddenly in COVID, 2 years into it, nobody feels like they're any good at it?
It's either they're very tired of it or they just don't want to deal with it, right? That's what I think it is. They're afraid. Maybe they're afraid to address it, right?
Maybe they're just gripped in fear, like, oh, this is going to go away and we're just going to get through it. Come on, once you get to a medical problem, you're 2 years into it. This has been the scientific opportunity of a lifetime. I mean, there could have been so many wonderful things that evolved in research, and Canada's just been on the sideline. They've been academically absent in COVID-19.
It's quite saddening to hear that. I know we are one of the forerunners, the front runners in medicine and taking care of patients up here, and there's so much talent, and we've just gone silent. I don't know if it's influence from the political side or people just afraid to just step up and do it. I know Byron Bridle, he did that and he got shunned for that, but I'm glad that he's still sticking to his guns. Is this almost over? Is this pandemic almost over, Mr. McCullough?
It could be. Omicron's interesting. It is blasting an epidemic curve larger than we've ever seen. It's obvious mass vaccination has done nothing. If mass vaccination was supposed to quell the pandemic, I mean, it is out of control. In fact, the most heavily vaccinated areas are having the worst time with this outbreak. And we've hit. I had a private conversation with the lab director yesterday. We hit in some labs 30% positivity rates. That means 1 in 3 people coming forward for a test are positive. You're at that point. It's like, why bother? You might as well just assume everybody has it. At this point in time, the vaccination program has failed. I think we should drop all the vaccine mandates, just completely drop them. And then we need to pull off the market and pause the existing vaccines and study them for safety and efficacy. We need to figure out why they failed. How come they don't cover Delta? How come, obviously, cover Omicron, so have, a massive outbreak of Omicron? It's obvious the vaccines have failed. That needs to happen. And you know what? You can insert a ray of hope here that Omicron, it's pretty clear, has closed the immunologic door on Delta. Paper by Khan from Africa has shown this. Omicron's brief and mild. Very low rates of pulmonary involvement, should be very low rates of hospitalization, death. When people get hospitalized are these panic hospitalizations. They don't need to be there. And hopefully could finish it out. Now, if the virus mutates again and finds a way to break through Omicron immunity, we could be off to the races again. We'll have to find out. This one's going to be brief, though. It's not going to be like Delta, where it's 6 months of very, very difficult patient care. I tell you, I'm exhausted from Delta, and so I can't wait for Omicron to just spike. They in the schools for an extra week or two here before the kids go back to school. I think that's appropriate because this is such a big swell. It's affecting everybody, and largely everybody's getting it at the same time.
Well, it's good to hear from you, doctor. I think we'll have another conversation if we're still in this come 6 months from now. I really appreciate your time. I thank you for taking the time out of your day. I know you're very busy. I've had some conversation with your I was one of your workers, Caroline, as well. She said you are horrendously busy. There's people calling you about myocarditis and lots of side effects and
Yeah.
lots of things going on. And it takes a lot of courage for someone like you to step up and talk about these things, because I feel that that's what needs to happen. People need to start talking about things, and you're one of the people that stand out in front of the others. And I thank you so much. It's once again, it's been a pleasure, and I think we cleared up a lot of things, a lot of confusion for a lot of Canadians and people around the world listening to this show. Uh, all because you had the answers for us. Thank you so much.
Well, thanks. So hopefully I stimulated Canadians to give their hospitals a call and ask them where their protocols are, where their center of excellence. Canadians need to stimulate things a little bit. The population they can't just wait for someone to hand them an answer. Hopefully everybody listen, will build their own survival kit if they're still COVID susceptible and get through it. I've got family members in my family who are, Canadian citizens. So I am very familiar with the country, been there many, many times, and we wish Canada the best. Let's hope in 6 months this is over with and we can move on, and we'll talk about the next great thing, maybe the spring baseball season. So we'll see you soon.
Take care.
Thanks.